Benign prostatic hyperplasia, or benign enlargement of the prostate gland, is a very common condition affecting 50% of men over the age of 50. So a large proportion of men will have symptoms due to this condition. They can be very mild, or they can be more troublesome and require treatment. So it's an extremely common condition of the aging male. It's like developing arthritis. And what happens is that our prostate glands grow as we get older, and that's stimulated by a hormone called testosterone. So it's part of aging that the prostate gland enlarges or becomes hyperplastic, and then it can press or kink or narrow the urethra or water pipe where it runs through the prostate gland. The symptoms of prostatic enlargement or benign prostatic hyperplasia are varied, but typically they wax and wane. So you can have a good day or bad day, or a good week or a bad week, and they're typically going to the loo more frequently, getting up more often at night. One may notice that the flow is slower than it had been previously, or it can be intermittent or difficult starting the flow. Sometimes the bladder can become irritable as a result of the obstruction, and then there is a need to rush to the loo, and we have urinary urgency. And this essentially can cause disruption, not just with nighttime sleeping, but also with daytime activities, and it can make car journeys difficult. It can make going to meetings difficult. So it has a knock-on effect in terms of our quality of life and day-to-day activities, and it can be quite significant, particularly as we get older. So traditionally we've had medications and bigger operations. Rezūm is a minimally invasive therapy which involves passing an instrument up through the urethra or water pipe, and when we get to the prostate gland just short of the bladder, we make little injections of steam into the prostate gland, and that would be anything between 4 or 5 up to 15 injections of steam. It's very quick to perform, taking 15 to 20 minutes, and it can be carried out under local anaesthetic with sedation or a short general anaesthetic. What is happening when we inject the steam is we are literally heating up a water droplet up to 103 degrees Celsius and injecting it into the prostate gland, into the benign enlarged prostate tissue component of the prostate gland, which is pressing on the urethra or kinking the urethra and affecting the urine flow. Each little injection of steam destroys or kills or ablates an area of prostate tissue about 1.5 centimeters in diameter, and we work our way around the prostate gland and destroy about 45% of the volume of this enlarged prostate tissue. And what's good about it is that we're not leaving anything behind. Once we've injected the steam, the healthy tissue dies immediately, and then our own body develops a reaction to that and heals it, and the dead tissue shrinks and disappears, and the swelling settles down, and that takes the pressure off the water pipe and improves the symptoms steadily over the 2 or 3 months that follow the intervention. So before having the procedure, it's important, of course, that we do a number of tests. We'll make sure that there isn't any evidence of prostate cancer. We'll do a urine test and have an understanding of the size of the prostate gland, and a flow test. So we just need to be sure that there is an obstruction and to know, what sort of size the prostate gland is. Typically, we would treat men with a gland volume ranging from between 30 up to 100 mils in volume. We have treated some men with prostates slightly bigger than that. And of course, we'd run through all the issues that might be helpful in terms of the post-operative recovery, and try and sort of manage each individual's expectations, because no two patients are the same. And so we would talk through various issues before the intervention. Afterwards, typically men are discharged home the same day. 1 or 2% might need to stay overnight, but the vast majority of men go home the same day with a little catheter or tube that enables urine to drain from the bladder. Normally there is a little tap on the end of the tube, a little valve so that when your bladder is full, you open the tap and urine drains out, and you would go home with that for a few days, and normally returning after the weekend to have it removed. Once the catheter has been removed, slowly but surely, the urinary symptoms improve. It can take a few weeks for those symptoms to settle down and to really start to see an advantage, because we're relying on the body's natural healing properties to shrink and remove that dead tissue so that the prostate becomes smaller and takes the pressure off the water pipe or urethra. And so it's usually at about week 3 that we start to see a real sort of improvement in the urinary symptoms, and that continues for 2 or 3 months. And we can see benefit sometimes for up to 6 months after the procedure. From the American data, the proportion of men needing or needing to go back onto medication or having another surgical intervention is very low, with I think about 8% of men by 4 years needing either to go back on medication in about half of them, at about 4%, or having another surgical intervention in the other 4%. And I would anticipate, though I can't say this with certainty because we don't have longer follow-up data, that around about 10%, maybe slightly more, of men might need another intervention within a decade of the procedure. But the advantages are that the treatment is, of course, very unlikely to cause any harm, and therefore is an attractive option, particularly, I think, to men in their 50s and 60s. So the benefits of Rezūm, which is one of the minimally invasive therapies over the traditional surgical options, are that it can be performed as a day case and potentially under local anaesthetic with sedation. But more importantly, I think it's about the favourable side effect profile. So it is less likely to upset sexual function, so it's less likely to damage the erection quality after the procedure. In fact, it's extremely unlikely to do that. And it's also very unlikely that it will upset ejaculation after the procedure. And I think the other issue that men are particularly concerned about is the concern that they may leak urine or lose urinary control after the procedure. And that is something that just doesn't happen after Rezūm.